Thank you, Chairman and Ranking Member, and our witnesses. I want to first address an issue of concern to me, the handling of positive COVID tests and death reporting. From some estimates, the federal government has been reimbursing healthcare providers anywhere between $5,000 to $39,000, depending on the severity of the case. And that is, providers get a 20% add-on payment for Medicare and COVID-19 patients over non-COVID patients. Clearly, there's a financial incentive to report, if not inflate, COVID cases. The Democrat governor of Colorado retroactively lowered their fatality count due to inconsistencies by 12%. Cause of death after a motor vehicle trauma that's sudden death listed as COVID is not proper. If it's just 10% inflated nationally, that's 15,000 plus cases getting the extra 20% where it's not warranted. It also affects the number upon which important decisions are made. And I'd like to take this opportunity to ask the chairman to request that the GAO conduct an audit of every single COVID death, how the reimbursement payments work, how exactly the amounts are determined, the extent to which waste, fraud, and abuse may be occurring. This study would be extremely helpful to Congress in how we can protect taxpayer dollars and direct relief to legitimate causes. Now on to the topic of sending kids back to schools. I believe we must listen to the experts. The CDC says, quote, "The best available evidence indicates if children become infected, they are far less likely to suffer severe symptoms," end quote. The CDC advised that, quote, "Aside from a child's home, no other setting has more influence on a child's health and well-being than their school," end quote. Let me note that children account for less than 7% of U.S. cases, less than 0.1% of deaths, and almost all of those have confounding medical variables. In other testimony before the Oversight Committee, Dr. Redfield said 7.1 million children get nutritional behavioral health counseling from school. Adolescent suicides are on the rise, child abuse is on the rise, and schools and teachers are typically the first to report it. Dr. Redfield even said this is not public health versus the economy. For the children, it's public health decision versus a public health decision. Let's open the schools. That's what he said. As a physician, I'm keenly aware of the risk-benefit decisions. Often we prescribe medications with significant, even deadly side effects. But we weigh the benefits of the drug with those risks and we make the decision, many times to give the drug because the chance of a good outcome outweighs the chance of a bad. I promise you, everyone listening to me has done just that. Motrin causes gastric ulcers and aspirin toxicity can kill. Dr. Redfield from the CDC was clear. The risk to students being out of school, risk to their nutritional health, risk of suicide, risk of child abuse, loss of mental health counseling, loss of school nurses providing a degree of health that they can't get at home, all will produce far greater harm to our children than will be harmed by COVID-19. It's not even close. On the other hand, the argument for adults, 33,800 additional dead from undiagnosed cancers, additional 77,000 suicides, the massive increases in out-of-hospital cardiac arrest may or may not balance those lost due to COVID. So for adults, the risk-benefit ratio is harder to make. I completely agree. But in children, that risk-benefit ratio is undeniable and undebatable. If we do not open our schools, we will do far more harm to children than we ever would letting them return to the classroom with social distancing, etc., and while protecting at-risk students and teachers. One witness today stated that we'd lost over 400 children to COVID-19, all of which are tragedies. The witness mentioned that we should act to save just one life, or in other words, we should close the entire nation's schools to save one life. If we follow that logic, we will never allow a single child to ride in an automobile. Last year, 4,074 children died in automobile accidents. If my math skills serve me well, that's 10 times more than died to COVID. Should we stop all children from riding in cars? No. As a physician, I firmly believe the right decision is to reopen our schools. The risk-benefit ratio is right there. Now I'd like to make one more point. Nowhere in the Constitution of the United States does it give the federal government a right to tell Tennessee whether we can open our schools. This whole discussion is federal government overreach. Tennessee is quite competent enough to make this decision on its own. We need to stay out of Tennessee and our other states making this decision. Thank you, Mr. Chairman, and with that, I yield.